Imagine being on the front line, not just battling but outsmarting infectious diseases every single day. That's the daily reality for clinical pharmacists in the infectious diseases department. Their arena? Hospitals where the stakes are high and the need for precision even higher. Each day, these pharmacists dive deep into the complexities of diseases like influenza, tuberculosis, and MRSA. They don't just dispense medications, they tailor therapies based on the latest research, patient histories, and evolving pathogens. It's a dynamic battlefield where knowledge and adaptability are paramount. From reviewing patient charts to consulting with healthcare teams, their role is pivotal. They ensure treatments are not only effective but also safe, minimizing potential drug interactions and side effects. So, what does a day in the life of these unsung heroes look like? It starts with a thorough review of patient cases, followed by rounds in the wards, discussions with doctors about antimicrobial stewardship, and constant updates on the latest in drug resistance. Their expertise does more than treat. It prevents outbreaks, educates staff, and safeguards our community. Every decision, every recommendation holds the power to change outcomes. In the world of healthcare, these pharmacists are the vigilant strategists behind the scenes, making monumental impacts one patient at a time. Join their journey, learn from their challenges, and witness the art and science of pharmacy in its most critical form.